different people's version of their homemade yarrow, salve or tincture. And after about an hour, I was like, I can do this. And I got up, my double vision was gone. Of course I still had all this bruising all over my body, but it wasn't as bad as it was. I got up, my brain was sharp. I did good for the whole for the whole lecture.
I actually think I arrived late, and
You did arrive late.
I didn't realize any of this had happened. She just seemed totally normal.
Yeah, I mean, seriously, you were late. I know that you did arrive late. So, and the whole time I'm thinking, be careful what you ask for. I said, I don't know yarrow. I really need to learn about yarrow. Thinking, be careful what you ask for. So it was like every single one of those things Matthew talked about, except for maybe the reproductive, I got all at once. All those lessons with that plant, I got all at one time. I did the weekend. I left with half a 2-quart bottle of yarrow tincture that I brought home with me to have at home. And it was like, I never went to the doctor when I got home. My head got totally clear, the contusions, the hematomas went down. I did go see my chiropractor who was going, I've never seen such jammed up vertebrae. What happened to you? Because initially I just landed like that on my tailbone. And my tailbone was off to one side, but not broken. And so it took quite some time for me to totally, several weeks to totally get healed up. So in the meantime, I'm at home, 12-year-old, maybe Raven was maybe 10 at the time. I'm cooking supper, and you know how it is when your kids are you're busy and your mind's on one thing, your kids are going, Mom. And I'm chopping potatoes, and she's going, Mom. And I chopped off the end of my little finger. Totally off the end of my little finger. And the shock was so immediate, and I was like, oh. And right at the end of your little finger is an artery that loops up and goes back down. And so every time my heart beat, the blood was going chunk, chunk. Because you could see the artery sticking up for some reason. The end of my finger was gone, but the artery was sticking up. And Raven, my daughter, was freaking out. And she was going, oh my God, Mom, my heart was going beat. It was going shoot. And so I would say to her, get a yarrow. And so she said, which one is that? And I said, that big brown bottle over there. So she went and got it, poured me some in a dish. We added a little bit of water and stirred it around, and I stuck my finger in it. Right? This is a pretty severe, literally the end of my little finger was gone. And so I kept it in there because it was still continuing, that artery was cut, and it was still continuing to pump out. It was just flat there on top. And so it took about 20 minutes for the artery to seal, and it did. And the blood stopped. And then I'm looking at my finger, and you can see the little thread, because the artery is small. It's a tiny little artery, but it was there. So this is the 3rd level, right? So, I bandaged it up, which was really hard to do because it was really sensitive. All those nerves had been cut. And so every day, 3 times a day, for about 5 days, I soaked a bandage and all in yarrow. And I would soak it for 20 to 30 minutes at a time. I would just put it in there. My finger totally grew back.
That was pretty crazy.
And I continued putting yarrow on it for a good, after it started, healing, once or twice a day, I would just stick it in there while I was doing something for 5 or 10 minutes. So the end of my little finger totally grew back, the end of the nail, everything. I think the reason it did was because it didn't go to the bone. It didn't hit the top of the bone. It just got all the flesh you get at the end of my finger. But totally grew back. I have a tiny little bit of nerve damage at the end of the finger where the nerves didn't quite heal. And if I hit it a certain way, I get a little pink, right? But otherwise, totally. So those are my 2 major yarrow stories. Do you need any other yarrow stories after those?
The other ones are all similar to that.
So I have no other yarrow. I needed no other yarrow stories. I got all my yarrow. Basically it was like being in a car ride falling down the stairs. stairs got worse. I mean, I was lucky I didn't break my neck or break my leg or fracture my spine.
Yeah.
I mean, the fall was totally that severe. And there were really high steps with a really long incline. And massively cutting off the little finger. So I really got all of the wound healing properties of Yarrow in those kind of like two adventures there, and have used it in those ways ever since. But as I began my studies of Yarrow, so for about 3 years, I mean, that was a plan I focused on, really trying to understand all its uses and reading about it and using it with clients and everything. And some of the things I observed in Yarrow is that I didn't have great success with it for fibroids.
So what?
I did not have good success with it with fibroids.
Fibroids, okay.
And I tried it with 20 or 30 clients, and it just didn't work. So I kind of like, well, okay. So when Matthew said it was anti-estrogenic, and that made sense in some ways, because with my view of what causes a fibroid, why a fibroid grows, a fibroid, as he said, can be either internal inside the uterus or on the outside wall, or a third one is it can be out on a stalk.
Yeah.
With a stalk attached to the outer wall of the uterus, and the fibroid making space and can get quite large over here someplace. The ones that cause the most bleeding are the ones that are attached to the inside of the uterus, and they're very close to the lining there. So they cause more bleeding. The ones on the outside of the wall, but attached, can cause bleeding, but generally not as severe as the ones on the inside. Polyps can also, inside the uterus, polyps can also cause bleeding, similar to what you get with a fibroid. And a lot of times, because those internal fibroids don't show up on ultrasound, because they're inside the uterus, people assume they're fibroids when they're really polyps, because polyps don't show up on the ultrasound side. So it's really hard to differentiate the bleeding from a polyp from the bleeding of a fibroid, because they're both inside the uterus. And so I came to believe quite a majority of the women who thought they had fibroids, who had never actually had a medical confirmation that it was fibroids, actually had polyps, because polyps are actually more common than fibroids are.
Yeah, that makes sense because it's an astringent which tones tissue, and polyps is like a complete loss of tone. So
Well, polyps are, changes in mucous membrane tissue inside the uterus. It's like a polyp in your nose, or a polyp in your bladder, or a polyp in your guts, in your intestines. It's mucous membrane tissue. So it is totally different tissue. And it is inside the uterus, and it does not show up on ultrasound. The walls of the uterus are really thick, and those tissues, sometimes if they're really big and they're really giant, they'll show up, but most of them don't. And it's only if they're doing a DNC or they're doing a look inside the uterus that they find the internal fibroids and they find the polyps on the inside. And so I suspect that a lot of women actually have polyps and
that
not
makes sense.
fibroids.
Yeah, because it's being astringent, it would restore tone. That makes a lot of sense that way.
And
so a diverticulum is kind of the opposite of a polyp. too,
Right.
so.
Right, exactly. And a polyp can come and go because it is mucosal tissue, where a fibroid is muscle tissue. And I have read that a woman is born with a seed of her fibroids already there. And they either become active or they don't. And some of it even though your mother had fibroids. So that the uterus is all, the tissue in the uterus is all Uterus. Okay, so the muscle tissue there isn't smooth, it's like this shape. It has these circular striations in the tissue, so it can stretch for pregnancy. If it was like muscle striation like that, it would only stretch one way, and pretty soon, like our band is going to pop. Okay. So what we have all over this very unique organ is this. I kind of like think of it as like more. It almost looks like it has no pattern. There's so many little whorls and circles and lines in it. All right, but this does let it stretch. So where these little whirly areas kind of meet, right in the center is the potential for the fibroid. Because this is where the tissue all comes together of that whole little segment. That's the center of it. Is this good so far? Is this what? Yeah. All right. So the whole uterus is hormonally active. And it's influential by hormones in the environment immediately around it and what are circulating in the blood. So as a woman goes through menopause, and I used to say through menopause, but now what I'm seeing is there's a number of girls who are getting fibroids. The fluctuation in hormones encourages the growth of the fibroid. And so from the wall of the uterus, the fibroid can go, and it's generally kind of irregular, and say that's the outside wall of the uterus. It can be like that. On the inside of the uterus, it can do the same thing. These are the ones that cause the most bleeding. A polyp kind of goes like that. But it can cause bleeding too, because it's still connected to this mucosa. And the uterus is just like your nasal passage. No, it's more like closely akin to the bladder. You've got muscle tissue coated with mucosal tissue. So any kind of irritation to the uterus can cause a polyp. And as the body heals from the irritation, that polyp can actually shrink. Polyps are the number one cause of bleeding in the postmenopausal women. I've had clients who are 70 years old who started bleeding again, had to go in and have a polyp removed. Okay, any questions so far?
What about polyps in the colon?
Same deal. It's mucosal tissue on top of muscle tissue. Same deal.
Yeah, Yarrow makes a lot of sense for that too. Hemorrhoids, diverticulum.
All right, so basically when you have a polyp, get rid of the irritation, and the polyp will go away. So like in the colon, and changing diet. You've been eating a food that's been irritating you a lot. Quit eating the food, the polyps will start shrinking. Polyps are usually in the lower colon, not the upper, which is where the last area of the offending substance might be. Change the diet. But left, it can turn cancerous.
Right.
In the uterus, polyp left can turn cancerous. Same deal.
So it doesn't have to be physically removed?
Or shrink, you know. Now, it's harder to know what the offending substance was in the uterus than in the colon, where it's, probably going to be food or some lifestyle situation. Smoking affects this.
Again, use Yarrow before you surgically try to remove it.
Oh, there are a lot of remedies we just go with.
Yeah.
Smoking definitely affects blood flow at the mucosal level, so I really encourage everybody to stop smoking cigarettes. And that is a huge, major factor here. And that would be the first level of blood, capillaries.
Yes.
And then smoking, actually, the longer you smoke, the more it moves into the second and third level of tissue of blood. So it's harder to know what the irritation was. Sometimes it's like a little piece of the lining that started to get shed and didn't quite get shed, and it gets trapped, and then the body starts wrapping mucus around it to isolate it. Generally, a polyp develops because the body's trying to isolate something. That's what the body's trying to do. It's isolating something. It could be a bacteria. It could be a dead virus. It can be a little piece of, rubbish trash, a toxin. The body is isolating something. So in the lining of the uterus, it's probably most likely going to be a piece of the lining that didn't shed but didn't get reabsorbed either, right? Or a sperm that died when it come out. That's one advantage of having a period every month is whatever gets up there is going to get cleaned out once a month. So that can happen too. Or also I've heard of eggs that implanted, started dividing, died, but didn't totally come out and didn't get reabsorbed. They can cause a polyp too. So there's a lot of different things that can cause that. One lady, when they looked in her polyp, was a little piece of bone. Apparently she had been pregnant at some point, the baby died, the body started reabsorbing, but not the bone, a little tiny piece of, and it was tiny, there was a little piece of bone at the center of the polyp. So there's a lot of different things that can cause that. So you have to differentiate, is it a fibroid, is it a polyp, and it's hard to tell. And I'm still working on trying to differentiate between the two. I generally think if I'm trying Yara and it's having no effect on the bleeding at all, I don't think it's a polyp.
Wait, you are going to think it's polyp?
Yeah.
I would think Yara would be good for polyps, though.
I've not found it to be true because the Yara is connected into the the fibroid is connected into the muscle, which has a different blood flow to it. It has a stronger blood flow to it. The fibroid actually does. The polyp doesn't have a gigantic network of blood going to it. It's just pulling it, lining, and making it bleed more. Did I say that right? Understandable?
Yeah, but Yara is kind of for both states because it tones tissue in the astringent and it kind of normalizes when there's too much blood flow, I think, too.
Well, I've just not found it to work as well. I had one client who had had bleeding for a year, over a year. She was trying everything she could think of to stop the fibroid bleeding, and she'd been doing Yara very faithfully the whole year. And so when I met with her, we were changing her diet, we were adding iron into it because she was anemic, she was bleeding so much. We're doing Yellow Dock in addition to mineral iron to add all into there. And her husband was very supportive of her process and doing it naturally. He was into herbs too. I added a couple things in. Nothing changed, and I'm thinking, this is not a fibroid, this is a polyp. The Yara is not working, the cohosh isn't working, the shepherd's purse isn't working, and all the normal things you think would slow down bleeding a little bit, not working at all. So I gave her cayenne. Cayenne slowed down her bleeding more than anything, which is another good bleeding remedy. It can either thin the blood so you bleed more, or not really thin the blood.
It just increases circulation.
It increases circulation. But it can stop bleeding too, topically or internally. It's just an old, so there's another bleeding remedy. I've used it over and over to stop bleeding internally. And it's excellent for that. Tommy Bass, one of my teachers, he had a congenital heart defect. He had 3 or 4 heart attacks before he died at age 89. And it got absolutely gone. But every time he felt a heart attack coming on, he went for the cayenne. He would do a tablespoon of powdered cayenne he kept around. So cayenne is also in the south, and he was taught that it's a remedy for a heart attack. It kind of keeps the blood flowing, it keeps it from clotting, it stimulates the heart to maintain action. So you can have that. So anyway, the thing that began to slow it down for bleeding was the cayenne. And I was like, okay, time to rethink this whole fibroid thing. Because fibroids are not as clear-cut as people want to think they are here. And so then I thought, you probably have to follow. And so the cayenne has been working pretty good. And I asked her just to stop the Yara and stop the shepherd's purse because they weren't working. She'd done them a year, and they weren't working at all. So then her husband called me one day and said, it's her period, she's bleeding really bad, she bled 2 weeks of the month, which is one indicator that it's probably thought, could be a fibroid, because it kind of tends to be what happens. But because of the changes in the mucosal lining, a polyp can do that too. And he said, she's bleeding pretty bad, and I said, is it more than a pad an hour? And this is a pretty good indicator of bleeding. If somebody's using a super pad, size pad, and it's overflowing in an hour, you're in go to the emergency room situation. And so that's what I said. I said, take her to the emergency room. I said, well, she don't want to go, and I said, put her on. And it turned out she'd been doing this for about 4 hours. And so I said, you just have to go to the emergency room. When you get there, you don't have to stay. Just listen to what they say. I'm going to feel a lot better if you go to the emergency room. She needed 3 pints of blood. That's how much she had bled. That's how anemic she was. And, and she'd been fighting having her hysterectomy for this whole time, because that's what the doctors were saying. You've got to have a hysterectomy. You're just bleeding all the time. There's nothing to do. And she still wanted to have a baby. Her and her husband still wanted to have a baby because they had no kids. So this is why she'd been trying so hard to get this bleeding stopped so that she could have a baby. She was also 39 and had not had a baby. So she was if you don't generally you have a child before like 26 or 27, menopause is going to come earlier. And that's just statistically true. Maybe not be individually true in a room full of people, but if you have a couple of kids by 30, you're probably going to be average menopausal age, which is 50 to 52. You don't have a kid by 38 or 39, then you're probably looking at 42 or 45 as the menopausal age. So that's something that kind of, you use it or lose it. That's kind of what nature does. So she ended up, I wasn't the only herbalist she had seen in that time period. She had seen 2 or 3 other very reputable herbalists around the country, not locally, and it never stopped. And so she ended up having hysterectomy because she was down to a life-saving situation. But it turned out on examination it was a polyp. A big polyp and not a fibroid. And it's hard to get the herb inside the uterus to the polyp. Now, since then, because she was like the big, massive, case that you learn from, you do everything you can, So since then, I now use, in this situation, if I know it's a polyp, I now use suppositories. They seem to work a lot better.
What about a wash or like a douche?
No, not a douche, because a douche can force things up inside the cervix.
Oh, okay.
You go through the cervix inside the uterus, can actually push infection up into the uterus, so you don't ever want to do that. But I started having, using golden seal. Now, there's this other thing that happens that so we have.
This is a good mucosal tonic.
So here's the uterus again, and here's the mouth of the cervix, which is the opening into the uterus. 2 weeks of the month, this is turned back. So the opening is not really available. The last 2 weeks of the month is turned down. So it's the last 2 weeks of the month, and you can work on the polyp right before the period starts. After. Because it changes so that the blood flow comes out easy at the end of 2 weeks if you're not pregnant. But it really tightens up and puckers because the estrogen tightens it up and shifts the opening of the cervix back just a little bit. So it's a doctor on examination can still feel the opening of the cervix, but it's tilted back a little bit. So closer to the period, the fuller the uterus gets, the more it drops forward again. So when it's dropping forward again a little bit, that's a good time to use the suppositories, uterine suppositories.
How do you make one, just in general?
When ovulation is like 2 weeks after ovulation, you can always use the temperature method because a woman's, right? Is that what you're asking?
No, how do you make the suppository?
Oh, the suppositories are made out of dried ground herb and cocoa butter.
Oh, okay.
really easy to make. I take a piece of aluminum foil and wrap it around a pencil and pull the pencil out. And there'd be a little opening at the top, and I mix together my herbs, the cocoa butter, and then I pour it into that mold made out of aluminum foil. And I would stick it in the refrigerator. It's hard in no time, and I can break off segments as needed. And then have the women insert those as high as they could. Golden Seal tremendously, as in a suppository, tremendously shrank up the polyps.
Just goals.
Yeah. Just Golden Seal. And, you have to be a little careful with Golden Seal discovered, and I should have known, because what Golden Seal does is causes the top layer of the mucosal lining to slough off. And it'll do this in your gut. It's not to get antibacterial in the gut. You actually release that top lining of the mucosal tissue, and the bacteria come off with it. So it kind of like gives them not a good place to reproduce because you shed the lining. Sometimes the doctor will say, if you have a intestinal infection, you talk to your doctor, he says, oh yeah, you're shedding your lining. It means you're shedding your mucosal lining. Golden Seal will make you shed your mucosal lining wherever it is. So I had one client who had decided that the suppositories are a little messy. People have to wear a pad at night because the body heat melts the cocoa butter, and then all that drains out during the night. And she was like, this is too messy and too much trouble. I'm just going to do a douche with Golden Seal and, do it once a day and be done with it. Well, she made up a really strong concoction, and after the fourth day, her whole vaginal lining shed out. Well, it didn't hurt.
I bet it's scary though.
She was like, she called me, she's like, there's all this white tissue stuff coming out, and explained, I was like, that is your vaginal mucosal lining. Don't worry about it. You just get new. It's going to be nice and new and clean and fresh underneath there, but that is what it will cause the uterine lining to do too. It also draws. So, I'm sorry, I put plantain in there with it as a drawer.
Right.
Yeah.
Makes sense.
It was plantain and Golden Seal.
So somebody has like ulcerative colitis, could they use this type of
Absolutely.
suppository? Okay.
Yeah, or take it internally.
Yeah, Culpepper really likes plantain for a female remedy.
So it's now my favorite. Golden Seal and not yarrow, as much as I love yarrow, but Golden Seal and plantain are now my favorite fibroid remedies.
Would you have them do it how many days?
Take the third one.
I'm sorry?
How many times?
I had him do it 4 days in a row and then kind of check and see what was happening. Because, if it works, the period after this, it's going to have, be more bloody, more dark, and going to have clumps in it as the fibroid is drawn out. It'll come out. As a polyp, I'm sorry, as a polyp is drawn out, it's going to look like clumpy, dark, thick periods stuff coming out. Because the polyp might only be this big. It doesn't have to be this big. It could be like that big and still cause.
So when you say it's one of your favorite fibroid remedies, you mean because it's actually a
Polyp remedy.
Yeah.
And it's what people think is fibroids. It's what we come to say, if you're bleeding this much and you're bleeding here this time, it's got to be a fibroid. So now it's become my favorite, that remedy. I've actually only had 2 clients that I can say absolutely verifiably had fibroids, that the doctor said they had fibroids. All the rest of them, we were guessing. We were making an assessment, right? So you assess it might be a fibroid, but analysis are polyps. So the 2 clients I did have that had verifiable fibroids, one of them, here's her uterus. She had an attachment on the outside, a stalk, and she had a polyp almost as big as her uterus over there. It was huge. This is a real dangerous kind, because what happens is after this fibroid gets to a certain size, it outgrows its blood supply because it's this is its tiny
It's a
little blood
fibroid
supply.
or, well, yeah.
It's a fibroid. And it outgrows its blood supply. And it starts breaking down on the inside. And it starts dying and necrosing. And you have all this dead matter inside the pelvic cavity, and you're infected. And so generally they want to take those out as soon as they can. And they can cut this one out and do a little incision into the uterus and save the uterus, right? Because it's out there on a stalk. However, if they leave it, and I had a client who had one of those, had a laparoscopy, for the doctor to take a look at the fibroid to make sure what it was, and he really wanted to take it out, and she was going, no, I don't want to take it out, I want to do this naturally. Well, the problem with doing this naturally is this is your only limited blood supply to get the herbs there too. You have a very limited blood supply. And because it's outgrown its blood supply and it's dying, the body starts like limiting the blood to it. It's like, oh, you're dying, we're going to cut the blood supply off. So it's hard to get the blood out to it, to shrink it, and it's already dying. So what you're now doing is infection control. And trying to do it. So we worked for 6 weeks, and she would have pus, because it was draining, actually draining. Top of the uterus was up here, and ovary, fallopian tube, ovary, fallopian tube. This is open here, and things in here can drain and come out. So she was actually having some, this was like actually laying up against her ovary, not her uterus, sorry. So she was actually having some drainage coming out, and it was very pussy, and she would get bits of matter, and she was getting sicker and sicker and sicker. And so at this point with the fibroid is breaking down, the normal kind of herbs that you would use for that fibroid don't work anymore. So at this point, after 6 weeks of echinacea and herbs, blood cleansers, things, and we were doing, she was doing a massive amount of herbs just to try to keep her blood clean and keep this all moving and flowing. She ended up having a laparoscopic, and they did take it out. And, which was, in her situation, I think one of the best things she could have done, because it was infecting the whole area. And over here, up here where it was lying, there was no blood supply to get to it, to clear it out. So, it's a good lesson on you can't do everything with herbs. Sometimes you do need some surgery, or...
But she didn't know that until they opened her.
And when they opened her up, she told the doctor, if I have a fibroid in there, don't take it out. Because I want to do this naturally. Right, and that's when we worked 6 weeks on trying to help her break that down and get rid of it and get rid of the infection. So, and then she had to go back in for another surgery to take it out, and then they had to clean all the infection out. So it's good to get some diagnostics sometimes, medical ultrasounds and diagnostics with some of this, so you can really see what's going on in there. We can make assessments, and we can do the best we can, but sometimes it's nice to have a picture, right? The other person I had that was verified, and I've seen probably, 40, 50 women over the years, maybe more, who have said, I've got a fibroid. But, they're guessing, they've been told, some other herbalist told them, but they hadn't gone in for testing. And a lot of times fibroids don't show up on ultrasounds. If they're in the back of the uterus, or they may not show up, or if they're under a certain size, they won't show up. So even an ultrasound will not tell if there's a fibroid there. So the other one that was verifiable, that the person had a true fibroid. She came to see me. She was African American. She was 4.5, 5 months pregnant. She had, she looked 10 months pregnant, because this is what a fibroid will do. Because the uterus is bigger, is the one way to tell. A polyp doesn't make the uterus look bigger. Because it's kind of squishy and it flows in with whatever's going on inside there. A polyp is, Fibroid is muscle tissue, it's really pretty hard. So a woman with a true fibroid looks pregnant. And it starts like right here above, excuse my pants here, above the pelvic line, above the pubic bone, going out. It starts swelling right there and coming up. Just like it would if she was pregnant, because the whole uterus now is growing. So, you can look at a woman who you think might have a fibroid, and if she truly has, because the uterus is right here. It's right back here. It's not up here. It's actually down here. It pushes up as it expands. So if she's swollen from her pubic bones right below her belly button, it could be a fibroid. And she'll look, whether she's had a kid or not, she'll look 3 or 4 months pregnant. The uterus swells, the fibroid is big, everything swells around it. She may or may not have excess bleeding. A lot of women with fibroids don't have excess bleeding. They just have the swelling. They may have longer periods, but there may not be massive bleeding. The Yara worked.
Wait.
She had longer periods.
The one with the fibroid out on
The pregnant lady,
Oh,
right? She's African American. She's pregnant. They've seen 3 fibroids. Right? They told her she can't carry the baby because fibroids weaken the uterine wall. Right? And so, I'm thinking, okay, she can't take this or this over this or because she's pregnant. Right?
But she's going to lose the baby anyways if she doesn't take care of the fibroids.
What? They're telling her she won't carry it full term. She's hoping to take it to 6.5 months so it might live outside the womb. And so I'm thinking, and she said, "Tell me, Obi-Wan Kenobi, you're my last hope." One of those situations where all right, no pressure, Phyllis. And you get that, people come to see you like, you're it, So anyway, so what happened was, I was like, what can I use here? And she was pregnant, but she was having some bleeding. And so they're saying, you're about to lose a baby, blah, blah, blah. And I'm like thinking, all right, she's not about to lose the baby for the normal reasons that you would about to be losing the baby when you're pregnant. She's about to lose the baby because the womb is not strong enough because it's got these fibroids in it. It's not strong enough to carry baby to term. So I'm like, what am I going to do? So, you think, what are your uterine toners when you're pregnant? Raspberry leaf, right? So I mixed raspberry leaf with Yara. You know what? She carried that baby to term.
I'm just thinking of
7.5 pounds.
the implications of if she did lose the baby and she decided to sue, she could take you both to court, the doctors or not the doctors.
Well, the doctors already told her it was a hopeless case.
Yeah, but so then...
And that she was losing the baby. She was losing the baby when she came to see me. She was bleeding. Right? So...
Yeah, but isn't there still that hope that the baby could survive and that you might have heard it?
No, it couldn't survive outside the womb at the amount of pregnancy she was.
Yeah.
That's why she was trying to make it to 6.5 months. I can't remember if she was 4.5 months or 5 months pregnant. So it was not would not have been viable outside the womb. Also have a disclaimer I have people sign, which may not be perfect, but basically it says I am not a doctor, I don't play a doctor on TV, I don't pretend like I'm a doctor. Anything I say or do is for educational purposes only. Right?
Consult your physician.
And the FDA said this.
Yeah. The FDA has no diet.
Well, no, they're only in charge of
It's the Board of
products.
Medical Practice, yeah.
Right, it would be like, am I practicing medicine without a license? And I'm saying I'm not, and this is for educational purposes only. And when my sessions, I don't use diagnostic language, I use assessment language in my sessions. And I do say, let me tell you about these herbs. If it was me, this is what I would do. These are my suggestions. I don't say take this. It's their choice to take it or not.
You don't say take this.
I don't tell anybody to take anything.
If you want stationery, say, if I were you, I would do.
I make suggestions, it's up to them whether they do it or not, it's like, I want to have a working relationship with my clients. I don't want to have a paternalistic relationship, which is what the medical profession has. So, and I make that clear, in the first session in disclosure, this is a working relationship. I believe in, these are your decisions. I'll give you the best information I know, but it's up to you to make the decision, and I'm willing to work with you on your decision, whatever way. But, here's the information. Here's my suggestions. This is what I would do.
After 30 years of practice, you have pretty good intuition.
You do that too.
You don't worry about people being litigious unless, hey, I feel these people might be litigious. So I've turned down consults because I just felt a bad vibe about it.
Yeah, I've done that too.
Yeah.
And she did. And she was just like desperate. African American communities in the South, they're just like huge divorce. That's their number one thing. I mean, tradition never died in them, so we have a lot of herbalists in your community too. So anyway, she took the herbs and the bleeding stopped. She kept the baby. So the baby she wasn't bleeding because of hormonal reasons, which is probably the number one reason pregnant women. Either they don't have enough progesterone or they have enough estrogen or whatever. She was bleeding because of lack of tone in her uterus because of these fibroids. And but the bleeding stopped, the uterus toned, and she carried the baby, full term. And the baby was fine, healthy. They named it after me. No, I'm teasing. That was a joke. But, in those, where the uterus is being compromised like that, I have found that Yara does work, but I found it doesn't work by itself. It needs a little bit of something with it. Another restriction, and I think raspberry and partridge berry are both really good to go with Yara for fibroids, because that's what we use them for otherwise. Raspberry and partridge berry are the uterine toners, and fibroids are like a tone in the uterus. So, I've used those, and I'll put some Yara with it. That make good sense?
Okay, I want to give a case history on Shepherd's Purse, though, because you've given one on yarrow and goldenrod. But Shepherd's Purse is a fibroid remedy, too. And that is more for the myomas, because Shepherd's Purse is a muscle tonic. And again, it's Maria Trebin who brings this out. She doesn't use it for fibroids, but she uses it for atrophy of the muscles, which to my knowledge, nobody had ever used it for that. Shepherd's Purse is a remedy we're still learning about. It is anti-hemorrhagic remedy, and it's more for oozing blood. Well, it's been used by midwives in the last 20, 30 years for sub-involution of the uterus. When the uterus doesn't go all the way back after pregnancy, so there's a weakness in the uterus and the muscle itself. Like we mentioned, the prolapse from the tendons. This would be prolapse from the muscle, and this isn't an astringent because you'd still have prolapse where you could use an astringent, like ash bark is used that way too. But this is where there starts to be weakness and atrophy, and then the myomas develop in that. So I had a patient who was about 51, 52, and she was she hadn't yet started menopause. She'd had 3 kids. She had fibroid myoma in the wall of the uterus that had been diagnosed, and she she was bleeding a lot. She just wanted a remedy for bleeding until she went through menopause, because then she wouldn't need to worry about it. So I started her on Shepherd's Purse, and this was 3 drops, 3 times a day, day after day after day, month after month. And the bleeding got better and better month by month. At about 6 months, I put her on nettles too, because I figured I wanted something to nourish the womb. And finally, after a year, because she'd just been to the doctor just before I saw her, so 11 months later, she goes in for yearly. And even before she got to the doctor, the radiology tech, because she had an x-ray, said, "Oh, your womb is like better shape now. Before it was elongate, it was like more oval, and now it's back in better shape. Plus, the myoma had migrated. Well, it was no longer a myoma. The fibroid had migrated out, and it was now on a stem in the interior. And surgeon just clipped it off, and that was the end of that. But the tone was improved, and the fibroids were actually, much improved. So I have never been able to cure that fibroid on a stick, that fibroid
No.
pedunculated. I don't know
think there's
why.
anything to do, well,
Yeah,
the osteoporosis blood supply, you can't get the herbs there.
yeah,
No,
yeah. If it's on the inside, it's maybe healthier. If it outdoors,
Right.
blood supply, boom.
it comes out, right,
Yeah.
it's just,
So the more you can think about what is going on here, the better off you are, and the more, and constitutional, see, the Yarrow person would be more muscular and intense, and more of a Pitta person, and the Shepherd's Purse person would be maybe perhaps a little weaker, not quite as strong.